Everyone, including children, adolescents, young women, can do a lot to help their physician. I had mentioned earlier that the kind of research I do is health disparities research, and within that, I spend most of my time thinking about how patients and doctors talk to each other. And it's important because physicians can only go off the information that we're given. And so as patients, you have to really be able to give us good information, and we have to know how to ask good questions in order to make a good assessment of what's going on. And as patients, if our physicians aren't really listening, or we don't feel like they respect us, or are not giving us optimal care, we may not trust them. We may not feel like they have our best interests at heart. And so we may be a little more nervous or wary about taking the medication or following the doctor's advice, and ultimately that's to our detriment as a patient. We may not have as good health if we don't do what the doctor says. And so how patients and physicians talk to each other and what happens in that encounter is really, really important. And that's what I actually spend most of my time thinking about. And so for patients, these are adult patients, but the same principles apply to everyone. As a patient, it's your job to own your health. And it's your job to make sure that your physician, your nurse, or whoever your healthcare provider is, really understands the symptoms that you have, really understands your life context and what's important to you, and really understands who you are, so that when it comes time to make a decision about what kind of medication or what kind of treatment plan, the two of you, the physician and the patient, can come together and come up with something that makes the most sense, that patients understand, that they know how to do, that they feel confident in doing, they can actually go home and do. And so as a patient, if you're leaving all that to the doctor, then you're selling yourself short, because the doctor only knows half of the story and you have to be able to provide the other half.